for this body scan, taking a position that supports wakefulness. It could be lying down, flat, or supported in some way. You could be seated in a chair, or even standing. Allowing this to be a stable, supportive position that you're in to support this practice of being with yourself, being with this body as it is in this moment. And as you choose a position that supports wakefulness for you today, know that it's okay to change positions if you need to, or if you choose lying down to even point the fingers, the lower arms up toward the ceiling, letting the upper arms rest on the floor so that if you were to fall asleep, the arms would fall to the ground, waking you up. Whatever is supportive for you, taking that position now. I'm drawing attention to the breath. What is your experience with the breath in this moment? Where is it easiest to connect with the breath? At the belly, at the chest, or the nostrils? And if a focus on the breath creates tension, anxiety, drawing attention to sounds or to the hands may be more supportive in this moment. Gathering attention to sounds or to the breath or to the hands, whichever one supports you now. Knowing that as we go through this body scan, you can always come to this place, this gathering of focus. Being just as you are, letting the body be just as it is, knowing that there'll be pleasant and unpleasant or neutral experiences or sensations that will come up during this practice. The anchor, the place of gathering attention, is always there. And when the mind wanders in the silence, or maybe you fall asleep, when you notice attention is brought back, just beginning again wherever we are in that moment, that body part just connecting in. And this too is presence. It's being in the very moment, mindfully. Inviting attention from the gathering place down through the body to the left foot, the left toes, noticing each toe and what's to be experienced there, the space between the toes, the way the toes touch. Experiencing sensations or no sensations, tingling, pulsing, cool or warm, hot or cold, heavy, light. What's the felt sense in the toes? Drawing awareness to the sole of the foot, top of the foot, the Achilles tendon, the ankle. Noticing the sides of the ankles, the bony parts of the ankles, the front, the back. What part of the foot is touching the floor or the surface you're on? Moving up through the foot, the ankle, to the lower leg, the front, the shin, bone or thin ear place, the front of the leg, the calf, the muscular calf muscle on the back. Any sensation in the lower leg. And if the lower leg is touching the surface in any way, or where it's not. Drawing awareness from the lower leg to the knee. Sensing the angle of the knee, the front bony part of the kneecap, the soft backside of the knee, the tendons, the muscles, the joint itself, the space between the joint, in and around, the sides, this whole knee and all its complexities. Moving from the knee up through the thigh, the hamstring, the quadricep, and all that's to be sensed in the left leg. gathering attention to the left hip. And all that's to be felt in the hip socket, the thigh bone in the socket, the muscles and tendons. Sensation. Moving across the left hip to the right hip, down the right leg, all the way down to the right toes. Experiencing the right foot, the toes, the space between the toes, how the toes are touching one another. The sole of the foot, top of the foot, the Achilles tendon, the ankle, the bony insides and outsides of the ankle, and all the tendons, bones that make up the foot, the muscles. Bringing awareness from the foot, the ankle, to the lower leg, the calf and the shin, the leg bones, the strong calf muscle, and the effort of the muscles to move the blood back to the heart. What is felt in the lower leg. Moving up from the lower leg to the knee, shining the light of awareness on the right knee, the bony kneecap, the soft space behind the knee, both sides of the knee, the joint capsule, space between the bones, the strong ligaments, muscles, the intricate work for the knee to do all that it can do, and all the sensations that are felt there. Warmth or coolness, pulsing, spaciousness or tightness, making room for all that is to be experienced now. Knowing that if any becomes too much, that point of gathering is always there to go to. Drawing awareness from the knee through the thigh, the front of the thigh, the back of the thigh, the quadricep, the hamstring, up to the hip, the right hip, the thigh bone and the socket itself, the tendons, the muscles, all the nerves, the nerve endings, and the sensation that may be felt here. And if there's pain, how big or small does it look like or feel like? Is it changing? Moving from the right hip to the pelvis, this pelvic girdle that houses the reproductive system, the ending of digestion, the anus. What sensations are there? Drawing awareness to the low belly and the low back. Just their tightness, spaciousness. Pulsing, burning, throbbing, tingling, stabbing pain. Allowing all of this to be. Drawing awareness up to the chest, the upper back. What's experienced on the outside. Maybe the clothing touching the skin. The body touching the surface it's resting on. And moving inward to the organs that are encased inside the rib cage, the heart. All its efforts for circulation of blood through the body, for removing waste from the body. Is there a beat there that can be heard or felt? And bringing awareness to the lungs, respiration. The expansion of the lungs to pull the air in. The release to let go. Expelling waste. Bringing in life force, air, oxygen, so the whole body can function. What sensations are felt in the lungs with the breath? And experiencing the other organs, the liver, the pancreas, the stomach, digestion, all the intestines. Drawing attention to the left hand, the left fingers, the curve, the straightness of the fingers, the bony knuckles, the soft pads of the hands, the palms or tops of the hands. How the fingers are resting on the surface or against each other or not. Bringing attention to the wrist, all the tiny bones that make up the wrist, the complexity of the wrist, all the movements it can make. Drawing awareness from the wrist through the forearms, the bones in the forearms, the muscles, tendons, the nerves. Coming to the elbow, the bony outer elbow, the soft inner fold of the elbow. Drawing awareness from the elbow up through the upper arm, the bicep and tricep, onto the left shoulder, to all the complexities of the shoulder, filling the arm bone in the socket, the tendons, the muscles, the nerves. Drawing awareness across from the left shoulder, the upper chest, the neck, over to the right shoulder. Moving down through the right shoulder to the right hand, fingertips, the tips of the fingers. Noticing the bony knuckles, the soft pads of the hands, the tips of the fingers, the palms, the back of the hand, the space between the fingers, the curvature of the fingers and hand. Drawing awareness to the wrist, to all the tiny bones of the wrist. Bringing awareness from the wrist to the forearm, the bones, the muscles, the nerves, to the elbow, the bony point of the elbow, the softness on the inside of the elbow. And drawing awareness of the upper arm, the biceps and triceps, to the shoulder, complexity of the shoulder girdle, the arm bone in the socket, to all the bones, the muscles, the tendons, the nerves running through the shoulder. Drawing awareness through both shoulders and the neck, the throat, the airway for the breath, the passageway for food, for nourishment. Drawing awareness to the mouth, the oral cavity, the teeth, the tongue that connects to the throat, the whole lower body that connects to the neck. Drawing awareness to the jaw, to the nose, the parts of the nose on the face, the nostrils, and what's inside and under the skin, the nasal passageway, receptors for smell and taste. Drawing awareness to the eyes, the eyeballs, the eye sockets, the optic nerves, the seeing, drawing awareness into the ears, the outer ear that can be seen, to moving in through the inner ear to all the tiny bones, passageways, all the tiny hairs, all that allow for hearing. Drawing awareness to the forehead, the eyebrows, the space between the brows, the top of the head, the back of the head, and all the connections from the top of the head all the way down to the tips of the toes. This whole body allowing the tension to gather back to that resting spot, the hands, the sounds, the breath. As this body scan comes to a close, maybe offering gratitude to yourself for tending to yourself in this way, for connecting this body, for making space for all that arose. And drawing awareness to the breath, Taking an inhale and an exhale. And bringing about some gentle movements, maybe wiggling the toes and the fingers. Maybe allowing the head to move from side to side. Seeing what movement is called for now for you.